Hey everybody, so this is going to be lecture video over Unit 11, at least part of it, and we'll go ahead and get started. Let's switch over here. So, Module 11, neck and trunk review. This is just a general review, kind of make sure you know the primary, secondary curves. In general, the actions of the different muscles just for stretchings, but really what you really need to know out of these are the major ones. So just like quadratus lumborum, trapezius, levator scap, SCM, the major ones. You don't need to know all of these. And then do make sure you go over all the special tests which are available for you in later things. So anyways, here's a video over cervical stretches. We have done that, kind of gone over that stuff a little bit, but it's there to review if you'd like to review it again. So herniated nucleus pulposus, this is just what's called a slip disc. I know we've kind of studied these before, but just kind of go over this and be aware of and refresh what it is. There are 4 different stages. Protrusion is just where it's barely starting to kind of bump out. Prolapse is where it is pushed through into the annulus fibrosus. Extrusion is that it's completely gone out even past the annulus fibrosis and into the epidural space, and sequestration means that has that part of the nucleus pulposus has actually broken off and is floating around outside of there and causing problems. So here are the symptoms that you can see with that. Here's a general idea of the treatment. Know the McKenzie protocol is good for HNP, herniated nucleus pulposus is what it's abbreviated as. We also use traction, which we'll learn about in PTOP 250 next semester. And just overall postural correction and then strengthening of especially the trunk extensors and stretching of the trunk flexors. So just know generally what it is and generally how we go about treating it. Here's pictures of what protrusion, prolapse, and extrusion and sequestration look like. Lumbar discectomy is just how this is treated sometimes if it gets bad enough. If we're not able to get to it, they go in and just remove parts of that annulus of the herniated nucleus pulposus and kind of seal everything back up to prevent the pain. A lumbar spinal fusion is if a disc is too damaged sometimes, or if a vertebrae itself is damaged or crushed, they will come in and fuse some of these vertebrae with just to prevent any movement there and to keep the space in between the different vertebrae. The main thing you need to know with this is that there's BLT precautions, which means no bending, lifting, twisting. Generally, it's 5 to 10 pounds that they're not supposed to lift. And no twisting, so when they turn, they're supposed to turn their whole body. Whiplash injury, it's just when your head goes forward and back too quickly, and it basically is tears of some of those muscles in your neck that cause pain and weakness in the neck, and it's got some stuff on how to treat that here. Gonna go forward here. So just some overall precautions. Mostly it's just to maintain those BLT precautions. Teach your patient log rolling. Different ones have different specific precautions, so those will be in your Kisner and Colby book. One thing I do want to point out here is peripheralization. Um, Peripheral just means it's towards the extremities, basically, things that are like further out from center. Peripheralization is how we describe pain from spinal cord blockages and the nerves coming out of the spinal cord blockages. So when people say they have a pinched sciatic nerve and they have pain that goes all the way down their leg and sometimes even as far as their foot, that's called peripheralization. And then centralization is when the symptoms um, from that pain start to head up more towards the back. And what's weird about that is it can be actually a little bit more painful and more localized in the back, but it's a good sign. So if you're treating somebody and they ever say, man, the pain is starting to go further down my leg, stop what you're doing because it means something has gone wrong and you're actually pinching that nerve more. Or if um, you're treating them and they say, man, the pain's starting to kind of hurt more in my back now, just know that that's normal and that's good and that's healthy. It's a sign that the nerve is becoming less pinched and less obstructed and is the space in between those vertebrae is doing better. So that's what you need to do with that. So anyways, just know those two terms there. And I think that's so general considerations, just some treatment for how to treat the cervical spine. So rice, but with some added stuff to it. Price mem is protection, rest, ice, compression, elevation, manual therapy, which is massage, and very light massage at the beginning, and then light motion and medications, right? So it's just another way to treat that inflammation in the acute phase, and just further things that you can do to kind of treat those in the acute phase, and then here's how you would treat the subacute phase. So just kind of be a little bit familiar with these. It's just a walkthrough and general things to kind of be aware of. And then this next section is just some basic core exercises. So on your assignment for this week, there are some different core exercises. You're supposed to do some core strengthening. So there are bridging exercises. So this is the earliest phase of bridging, just lifting up the buttocks, right? And so this is going to strengthen actually your whole core area, but it's going to help strengthen the abdominals and the hamstrings, and then you can make it harder by doing it with one leg out and just one leg here. You can also make it harder by tying the legs together with a TheraBand, or you can even make it even further harder by putting their legs up on a therapy ball. Planks these are also for abdominal strengthening. Actually, these up here also really strengthen the extensors as well. Just good exercises. These are abdominal strengthening exercise planks. You can do just knee planks and on your elbows to start with. If you want to make it harder, you do it on your full arms, or you can do it on your elbows with your legs out, right? And so actually this is the easiest, this is the next easiest, and then this would be actually the hardest. Also bird dog exercises here, where you can start off with somebody just lifting one arm at a time. They're in a quadruped position, kind of a crawling position. They lift one arm at a time, or then they can start lifting one leg at a time, or then you have them lift the opposite arm and opposite leg as it gets harder. These are good for both extensors and the abdominals. Here's a video from Dr. Joe about some good core strengthening exercises. Make sure you understand Williams flexion versus McKenzie extension exercises and when you would use those and when you would not. That's important. Um, so flexion exercises are just obviously flexion exercises. They're ones that flex the trunk and focus more on the abdominals and strengthening the abdominals. Um, and then there are McKenzie exercises. McKenzie exercises focus mostly on extension. They're used to help reduce back pain, help strengthen the back, especially good for things like herniated nucleus pulposus. They help to centralize that pain like we talked about earlier. And this really goes in phases, right? So the very first phase is just to get them lying down straight. A lot of times people's backs have been hurting so badly that they're hunched over. And so sometimes just getting them to lay on their stomach will help extend that back. The next phase is prone on elbows, where you have them prone on elbows and you see they're starting to get this extension curve. So they're stretching their abdominals, strengthening their back, and they're actually pulling those vertebral discs apart. Then you progress into prone press ups, where they're kind of almost doing a weird push up. They're taking their arm and fully extending it, and look how much extension they're getting in their spine now, which helps pull things apart and separate. You can also do these and move them up to in standing, where they're letting gravity pull them even further. So if you notice here, extension exercises may cause further damage in people with spondylolysis. So spondylolysis is when the vertebrae are starting to kind of fuse together and grow together. Spondylolisthesis is when the vertebrae have kind of slipped from each other and they're starting to kind of slide forward and cause damage to the spine itself. And facet joint dysfunction is when those facets on the side of the vertebrae are growing together. So in these situations, you do not want to do McKenzie exercises, right? But if it's a herniated nucleus pulposus, especially, then it's a great exercise to do. Also, sacroiliac joint dysfunction. The sacrum and the pelvis are supposed to kind of stay together and move together, but sometimes they get a little bit twisted or rotated off of each other, or the pelvis is too far forward, or even the sacrum can get too far forward. And that's what causes sacroiliac joint dysfunction. The sacrum and the ilium of the pelvis just aren't in alignment anymore. So there are ways you test for that. You look at the height of the iliac crest, if one is higher than the other, or if the front and back. So if the PSIS and the ASIS, if one of them is higher than the other in the front and back, you can tell that they've got some rotation going on. And if the pelvis is rotated, it's probably not in good connection. It's not working in unison with the sacrum like it's supposed to. But anyways, so the pelvis and the sacrum can, like I said, get off from each other. Also, you can, an innominate is just talking about your sacrum, okay? Anterior rotated sacrum, and this is what it will look like. It posterior rotated innominate means your sacrum, it's rotated backwards a little bit, and upslipped innominate means that one side of it has kind of lifted up, and so that whole side of the body at the hip and even at the spine will be kind of higher than the other side. And then you have your just general pelvic tilts that we've talked about. Here's a good video on treating sacroiliac joint pain. Shotgun technique, if you guys have ever heard of that, that's for kind of resetting the sacrum in the pelvis. And here's some good different treatments for posterior and anterior pelvic tilt, and also lateral pelvic tilt, where one side is, turn that off now. Lateral pelvic tilt is one side is higher than the other. So I think that's everything. So that's just a real quick run through. So just real quick, we as therapists can do pelvic floor dysfunction as well. It's not something we're going to go over in depth in this class, but just kind of review and go over this. But just know that, especially for women's health, there are different classes you can take that will focus specifically on pelvic floor and more gynecological type muscles, if that makes sense. And this does go over some ways to kind of strengthen those, but it's not anything we're going to go into in depth, and you're not going to have to treat it on anything. So look those over. If you have any questions, please let me know.